Welcome. We're proud to be part of the launch of the new VetSpecs WM5. The WM5, it's a wireless monitoring system, but what makes it really unique is it's designed for use in post-operative and critical care. And from what we can tell in the veterinary market, there's really not much available specific for those areas. Certainly a lot of options for traditional surgical and dentistry monitoring, but again, VetSpecs is thinking outside of the box with this new system. The WM5, again, as I mentioned, it is wireless, but what really makes it unique is the specialized sensors and probes that come with the system. They're not your traditional flat clip lead wires or pulse ox clip sensors, which can easily come off on patients that are in recovery. These sensors have been specialized for use in patients in recovery, and so we're going to begin to talk about that here. With that being said, I'm going to put the unit into a demonstration mode, and we'll get going. All right. So as you're looking at the monitor, we're going to be picking up the functions of pulse rate, respiratory, and then rectal temperature. Now, the WM5, aside from the platform itself, and VetSpecs is using the FLEX monitoring platform, which has been utilized for the last couple of years, a very, again, flexible unit. They're utilizing the FLEX platform as the base for the WM5 setup. Aside from the base unit, there are 5 components involved. We're going to be utilizing a receiver. This is going to plug into the side of the unit. A transmitter. This transmitter can be up to, from what we can tell, again, up to about 60 feet away in line of sight. And again, this is utilizing the high frequency Bluetooth technology. So it does very well. It's being beyond normal radio frequency and that sort of thing. So interference is highly unlikely. And then aside from the receiver and transmitter, we then have these specialty sensors. We're going to first talk about the pulse rate sensor band. This is an adjustable band which can wrap around the patient's limb. Could be the front leg, rear leg, or the tail. And what makes this sensor truly unique is it's utilizing a pressure-based material, a film that is underneath the fabric, and it's based off of counter pressure. And so simply, again, put this around the patient's limb, try to have this over an artery. There is an indicator on the inside of the sensor that says face down. And again, extremely sensitive, able to pick up pulse rate beautifully. There is on the transmitter a specific port that you would plug into for that pulse rate sensor. The next sensor is the Respiratory Sensor Pad. It's basically utilizing the same pressure-based film, and this can be placed underneath the patient's abdomen or chest wall. Again, these are for patients that are really in a non-moving state. And again, being counter pressure based, just simply place underneath the abdomen or chest wall, and it is able to pick up chest wall movement. And again, to just go back for a moment, your pulse rate will give you a real-time waveform with pulse rate value. Your respiratory, again, will give you a real-time waveform with the up and down movement as the patient breathes in and out, and then you're going to have your respiratory rate. One thing to note, we have noticed that if their patient is moving around somewhat, that it is perfectly acceptable to use basically an elastic gauze or an ACE bandage to basically wrap around the patient against the abdomen or chest wall area. That works out very well. The last sensor is the rectal temperature probe. Again, there are ports specifically labeled for these different functions. Go ahead and plug this in so that you can see what it looks like. So again, your pulse rate, respiratory, and now, last but not least, the rectal temperature. The rectal temperature probe utilizes a PVC material. There is a stainless steel contact at the end. This is where the built-in temperature sensor is located, And again, just insert to the rear of the patient, and you're going to pick up real-time rectal temperature. Again, just kind of plug this in so you can see what it looks like. Very small, very compact, very lightweight. This is operating off of 2 AAA batteries, and it allows for hours and hours of monitoring. It is, again, being lightweight. You could, if it's going to be for long-term monitoring, certainly could create to some level your own type of harness. Again, using maybe a vet wrap or an elastic gauze, an ACE bandage possibly, could wrap this to, depending on the size of the patient, possibly to a rear leg, possibly to the body of the patient. Again, quite versatile in regards to that, and we have found that seems to work quite well. As for the transmission, again, it is a Bluetooth signal up to 60 feet away in line of sight. You're going to notice that you have a glowing blue light. That is indicating that they are communicating. Blinking indicates that they are not communicating. So just a little side note there. As far as the unit, again, your pulse rate, respiratory, rectal temp. You do have audible selection. You can actually have an audible tone for pulse rate and an audible tone for respiration. And so those can be adjusted. You can also adjust and set high and low alarm ranges if you'd like to have those set. The audible is quite loud. Go ahead and turn this up for you. Oh, excuse me. And you'll have your audible tone. As for the information, at any time that you would like to take a look at, again, if it's a long-term monitoring procedure, you're able to look at trends. So this is actually going to line graph trend for you the patient's pulse rate, again, their respiratory, and last but not least, their temperature. Certainly important to note if you are looking for saving this information electronically, VetSpecs does provide a viewing software and a flash drive. Just simply plug in the flash drive to the side of the unit, and it will digitally record the entire procedure. And again, we'll give you those trend charts, or the trend chart for those different parameters. I think the last thing I'd like to note is that although this unit is designed for ICU and surgical recovery, it certainly could be used for traditional monitoring, for instance, possibly just the pulse rate for maybe use in dentistry. If you just needed to have a basic monitor, certainly if you wanted to have temperature running, basically the point being is that you could certainly use the system for alternative areas in the practice as well. Certainly appreciate your time today, and thank you for tuning in and watching this video.